Here's some of the things we're looking for on the tech scan. You can see directionality. One of the things we mentioned, you can see with these little cursors how they're moving in a roundabout direction. These are really supposed to go straight up and down, one to the other. And then you can see the lack of symmetry between the foot function one side to the other. All these areas of red indicate much graders of pressure. You can see those should be, we should want to see a mirror image one side to the other. This is what a tech scan shows. This is lining up the fourth gait cycle. You can see it when you follow the arrow. This is the fourth stance out of 7 stances. Again, you can see this lack of symmetry one side to the other, much higher pressures on this left heel and the forefoot versus the right. Both of these have shifted outside to the outside of the foot. These should ideally be straight up and down. And next thing we're going to show you some of the speeds. We want to try and get the speeds equal one side to the other. If you can follow these cursors one side to the other as we hop this forward, first thing we're seeing is the left heel, more pressures are initially hitting here. This is usually an indication of a leg length difference. As the weight transfers forward, again we're seeing the cursor on the right moving a little bit forward in front of the left. Now they've equalized. Again, higher pressures. Left forefoot versus right.
My background in kinesiology, which I'm not sure he knew that much about my background at that time, but I was able to very quickly ascertain that it wasn't a pile of bunk, and that this was the right application for the technology, and it was being used in a very sophisticated fashion, and that what he was trying to do made a lot of sense. So throughout that dialogue, he said, asked me if I had any back or neck problems, and I said, well, yeah, sure, I've got lower back problems like millions of other Americans. And he said, well, great, why don't I run you through? And he said, you know, good probability I'll be able to, you know, eliminate that for you. And I was initially quite skeptical. He ran me through the process and fitted me with orthotics. And even with the temporary orthotics that I was wearing the day that I left the office, it was quite a remarkable discovery. It was literally like someone flicking a switch, and not downplaying the lower back pain, but literally eliminating the lower back pain that I had in wearing the orthotics. And you know, the comfort improved when I got the permanent ones that I wear, you know, in all the different shoes, you know, transport them around with me.
Much more comfortable, yes, much more. We've adjusted the orthotics several times, but now my level of comfort has increased dramatically. But most of all, it was a subliminal reaction, because my ability to walk like a normal human being had a mental effect on me, which made me feel more pleasant. I feel more relaxed. I feel more like one of the crowd, so to speak.
I feel a lot more comfortable walking, standing. My job was originally standing on a lot of asphalt and a lot of concrete, and that has its wear and tear on your feet. You try various things over the years to try to alleviate the problems that you have. And really at this point there's nothing out there over the counter or available through a podiatrist that matches what we did.
One of the things that I like about working with Dr. Weiss is that he knows what he's doing, number one. Number two, he's a very personable person, so he wants to get to know you and he wants to get to know your feelings. But he also has, by the way, a great sense of humor, which I really like in a doctor. But he made the process simple, but he made it also so that I understood exactly what was going on at all times. And that's important, I think, for a patient to have that relationship with a doctor where they fully understand what that doctor is trying to accomplish, what the problem is, what the end goal is, and how to get to that end goal. And he's very good at that. The process worked the way it was supposed to work.
And you know, I mean, mostly we talk about, you know, relieving pain from people who are just trying to live their everyday normal lives pain-free. But you know, I see this as a tool that can help someone who is athletic, like, you know, in terms of myself and my running. I can run now and be comfortable and not have the same kind of pain I had afterwards prior to seeing Dr. Michael Weiss. It doesn't matter what age you are, younger, older, whatever. I think a young athlete who might have some sort of problems, with pain in a hip or a knee or an ankle or a foot should also check it out. I mean, it's not something that's just age-specific by any means. I mean, I would think the technology can benefit anyone, and I think sometimes when people are younger, they're less apt to go get a problem taken care of because, well, they're young and invincible, and that's just the way it is as far as pain goes. But no, I mean, you can actually relieve yourself of pain no matter what age you are if you have the right diagnosis and the right doctors and the right technology, and I think Dr. Michael Weiss has all that.
The WellWalk TechScan system can help eliminate back, hip, leg, and foot pain without invasive surgery for a fraction of the cost. TechScan is used by selected physicians at the Mayo Clinic, NASA, Yale Medical School, and Washington University Medical School.